welcome to the Men's Health Forum's balloon debate to launch National Men's Health Week 2009. And now, Dr. Biggles-Banks.
Thank you very much. Ladies and gentlemen, yes, Banksy Biggles or Biggles Banksy, whichever way you want to go around it. It's so lovely to see you all here, to listen to what the people in the basket are going to say and see whether or not they can keep the basket afloat and keep it up there, keeping men's health alive through the hot air that they are going to generate in very large amounts from the work that they are doing. Because what we're here to do tonight, ladies and gentlemen, is not to talk about all the problems, and we've heard about all the problems about men's health and so on, about the life expectancy. We're here to find out what can we do about it.
Lots of studies and surveys throughout the world have shown that men have a lower life expectancy than women. Is this for genetic reasons, or is it social or cultural? According to the host of our debate, Ian Banks, healthcare professionals have a lot of work to do to address the imbalance in life expectancy. What would you like to see as an outcome from this debate?
Given the audience, and given the fact that we've now got a wider audience, of course, for health professionals, politicians and so on, I think it's really quite crucial. It's probably the first time we've really addressed men's health at this level, at this very senior level, and looked at who's responsible and who should be doing anything about it. And really what we want to do is, first of all, improve the insight of the people who are not only watching the video, but also those inside the debating chamber itself, and really raise their insight about the problems to do with men's health.
And what would you like to hear them say?
I want to hear them make a commitment. I want to hear them talk about men's health as if it's a serious subject where we really do need to do something about it sooner rather than later. What we want from you and what we want from them is not the problem. What we want to know is what's the solution. Most of you in this room know there's a problem with men's health. You've known it for a long time, you wouldn't be here. What you want to know is what are we going to do about it?
The best place to get access to good quality health advice is through the workplace, because that's where I spend most of my time. We know from work by people like Gordon Waddell and Kim Burton that actually worklessness is the major factor in terms of ill health. Being out of work is equivalent in ill health terms to smoking something like 200 cigarettes a day. And if you're out of work for any length of time, particularly if you're a young man, your suicide risk goes haywire and your risk of depression and long-term illness gets really serious. And yet many of us inappropriately think that actually work is hazardous and somehow noxious and harmful. The question it really raises is, what is good and healthy work? There are many large employers now, Royal Mail's one, but it's a who's who. BT, Rolls-Royce, Unilever, Barclays, GlaxoSmithKline, now even the NHS are beginning to wake up to the fact that actually successful business needs a healthy workforce. And believe me, they're not investing in health at work just simply for the philanthropy and for the good of it. They're actually doing it because it makes good business sense. Many blue-collar men will speak more freely to their peers and their friendship groups, and they'll trust them better than they ever will with any doctor, pharmacist, or editor of Nuts preaching at them.
We now know that the workplace is one of the most effective venues for getting health information across to men. Think about it. Where do men give blood? You ever thought about that? Do they walk past a blood transfusion centre? Oh, I'll nip in there and give half an armful. No, they don't. They give blood at work. Why do they give blood at work? Because their mates give blood. They buddy up. They say, right, let's all go down and give blood. Now, if you use the same kind of structure over health issues, weight loss, cigarette cessation, and so on, men respond to it very well indeed.
So in terms of the two pledges that I offer you in terms of keeping this balloon afloat, one pledge is that I will use the opportunity of the review of the health and well-being of the NHS workforce to actually promote the good, simple and clear business case that good health for men and women is important to the success of an organisation. And then the second simple pledge that I make is that at the end of the day, the workplace is the easiest and the best place to actually reach people, and particularly men, with these messages. So thank you.
Thank you very much. Do we have any comments, please, from people who have a workplace initiative?
I think business has now recognized that occupational health and others, as Steve rightly says, can deliver much, much more in terms of health and well-being. The traditional messages of health promotion actually never ever reach the person that we want to reach, partly because journalists report different things at different times. One day you say cholesterol is bad, one day you say eggs is bad, another day you say, well, it's okay to eat eggs, so people get horribly confused.
We asked men, older men, about pharmacies. Why did they not go into the pharmacy, you see? And they basically said, because there's nothing in there for men, you see. And then we asked pharmacists, why do you not have anything for men? And they said, because men don't come in. In fact, one guy actually said, it's all lipstick and no spanners. You know, it's a beautiful quote and actually tells you an awful lot about the way that pharmacy works. Well, I'm afraid it's true. It hurts, but it's true.
Well, what do you actually do about that practically? Because it's unlikely that pharmacies are going to start selling spanners, are they?
Well, you know, you do it yourself.
Yeah.
Well, what you do actually is you can ask men what would they like to see in pharmacies, and we've done this, and what they want to see is more information. They want to see things upon which they can act.